On-the-scene coverage of AHA 13 is supported by Janssen Pharmaceuticals Incorporated.
The findings are quite important because it demonstrated no difference in the outcome of the patients, whether they were stented or just treated with very good medical therapy. In fact, the blood pressure control was very similar whether patients had stenting or not, because again, the trial provided very good blood pressure control with a diuretic calcium blocker and a angiotensin receptor blocker as well. So the implications are that perhaps stenting is not necessarily the right course of action, even though it's quite commonly employed in patients with resistant hypertension. This falls on the backs of two previous studies that were much smaller and left open some questions because the degree of narrowing in the artery in the prior studies was less. So these were patients with more severe narrowing of the renal arteries. So it's a little more definitive. It's a larger trial, and I think it probably puts to bed the whole question about whether stenting should be performed. There will be some questions regarding whether patients with very severe stenosis, high-grade stenosis, might be candidates for stenting. But in that subgroup of patients within CORAL, there was also no benefit of stenting versus medical therapy. The only question now is whether in the current era of renal artery ablation therapy, whether this might be a consideration. Of course, with ablation therapy, we're not talking about patients with critical stenoses, but there are new interventional techniques to treat resistant hypertension that are undergoing clinical trials in the United States as well. As far as a renal artery intervention for treating hypertension, it does not appear that stenting a narrowed artery is going to be beneficial. On the other hand, in patients who have resistant hypertension with less severe narrowing of arteries, then an RF ablation may be a consideration in the future.